Hello class, my name is Chiamaka Wakacha, and today we will be talking about aging in Nigeria. I chose Nigeria because that is where I am from. My family is from Nigeria, and I felt like this would give me a great opportunity to learn more about my country because I do have plans on, one day going back to give back. So, in Nigeria, older persons and their families face challenges in coping with functional, physical, and psychosocial health status of the aging process. So, these factors include changes in the family dynamic, increased demand for medical services, increased economic stress, and decreased functional independence. So, Nigeria is a nation that is growing every day. While the overall population is growing, so is the older population. About 5% of the 200 million persons in Nigeria, the most populous country in Africa, are aged 60 years and above. So this number is projected to increase to about 25.3 million by 2050. So although life expectancy in Nigeria is relatively low, the overall population of older persons in Nigeria is increasing, and this is due partially to the advances in healthcare. So this is the demographic profile of older adults in Nigeria. So back in 1999, there were about 2.1 million older persons in Nigeria. And then by 2020, it was increased to about 9.4 million people. And it is suggested or predicted that by 2050, that is going to increase to about 25.3 million people that will fit into this demographic of age 60 years and older. So in all, Nigeria's elderly population experienced about 740,000 people increase between 2018 and 2020. So as you can see, there has been a increase in life expectancy in Nigeria over the course of years. So here we have a little brief, linear graph just showing us basically how life expectancy has increased from 2000 to 2020. I will start with right now. This is 2022, and the current life expectancy for Nigeria in 2022 is 55.44 years of age. So we can even see that that's been an increase from 2020. In 2020, the average life expectancy was 55.02 years. 2015 was 53.11 years. 2010 was 50.9 years. 2005 was 48.25 years, and 2000 was 46.27 years. So we can see that there is something positive happening within the Nigerian culture that is allowing people to live longer, which is a great thing overall. So health problems and comparison. So the major public health issues facing Nigeria are like poor sanitation, control of vector-borne diseases, maternal and infant mortality, infectious and non-communicable diseases, sewage disposal, drug and substance abuse, alcohol abuse, environmental pollution, road traffic injuries, as well as some other things. We do see within these two lists that United States and Nigeria do have some things in common. However, it is also very prevalent to see that Nigeria does have a lot more, things that they're dealing with, such as like malaria, diarrheal diseases, most likely from poor sanitation within the water, environmental pollution, malnutrition, and hygiene. So those are some of the things that are going on in Nigeria that aren't necessarily going on in the United States. So while Nigeria is dealing with these things, the United States is dealing with things such as like heart disease, strokes, type 2 diabetes, violence, Alzheimer's, things of that nature. And I'm pretty sure that some of these other health problems that are listed within the United States possibly are also occurring in Nigeria and vice versa. But these are the main ones that I was able to find. So access to healthcare in Nigeria. So Nigeria has better health personnel than most other African countries. However, considering its size and population, there are fewer health workers per unit population that are required to provide effective health services to the entire nation. For years, healthcare network has been rated among the worst in the world. A 2018 study did list the global healthcare access and quality in Nigeria, 142nd out of 159 countries, which isn't a good look at all. In spite of the various reforms to increase the provision of health to the Nigerian people, health access is only 43.3%. The inadequacy of healthcare delivery system in Nigeria could be attributed to the peculiar demographics of the Nigerian people. And according to some reports, Nigeria provides healthcare for only about 3% of its population. So it is necessary to expand Nigeria's healthcare insurance program. And it is important to know some of the problems and challenges that Nigeria is facing currently when it comes to healthcare. So there's a toxic mix of problems, including inaccessibility to quality healthcare, poor hygiene, corruption, malnutrition, lack of access to safe drinking water, poor health infrastructure, fake drugs, insufficient financial investment, and lack of sufficient health personnel. So the healthcare system is largely public sector driven, but there is a substantial private sector involvement in the provision of health services. There are more than 34,000 health facilities, 66% of which were owned by the three tiers of the government, which are federal, state, and LGAs. So of the healthcare spending in Nigeria, 77% is out of pocket, according to the World Health Organization's latest data from 2017. This means that most Nigerians do not have health insurance of any kind, and the poorest Nigerians have extremely limited access to quality health care. So income. So monthly living wages for individuals and families in Nigeria. The median household income for Nigerians in 2020 is about 75,000 naira, which is equivalent to about $480 per month, or about $6,000 to $7,000 per year. The middle class makes about 23% of the Nigerian population, according to the African Development Bank data. And this is important to note because the Nigerian National Bureau of Statistics said that in 2020, that 40% or 83 million Nigerians live in poverty. So that's way higher than the 23% of middle class. 40% of Nigeria's population lives in the poor lower class. So although Nigeria's poverty profile for 2021 has not been released yet, it is estimated that the number of poor people will increase to 90 million, or 45% of the population in 2022, which is this year. And it's also sad to say that the combined wealth of the Nigeria's 5 richest men is about $29.9 billion, and that could end extreme poverty at a national level. Yet 5 million people face hunger. More than 112 million people are living in poverty in Nigeria, yet the country's richest man would have to spend $1 million a day for 42 years to exhaust his fortune. So pretty much this is a good example of the rich get richer and the poor get poorer. There's barely a middle class in Nigeria. So I'm hoping that, we can eventually find a way to close the wealth gap and to help those who need help, while still allowing the rich to, do what they need to do as well. Work culture. So the national minimum wage for federal workers in Nigeria reached about 30,000 Nigerian naira in 2021, which is equal to about 77 US dollars. So that sounds really, really good. But however, we are talking about this wealth gap. It's mainly because these federal jobs are not, available to any and everybody. You have to go to school, you have to do all of this. And what does that take? That takes money. So, excuse me. So those people who are fortunate enough to have money to go to school and stuff are the ones who are able to then in turn and get these federal jobs where they're able to make money like that. So as far as the work culture goes, conditions for workers in Nigeria are far from ideal. Civil servants and employees of private companies have relatively good offices and facilities, healthcare, and wages, but that is not the case for most of the others. So daily hours of work are to be fixed by mutual agreement or by collective bargaining. Provision is made for rest intervals of no less than 1 hour in total if the day's work is longer than 6 hours, and for 1 day's rest per week. After 12 months of continuous service, a worker is entitled to an annual leave of at least 6 working days that may not be deferred by more than 12 months. Women are entitled to 12 weeks maternity leave with at least half pay, but usually the customary benefits are more generous with maternity leave, fully paid. Also, Nigerian labor laws prohibit forced or compulsory labor. They also prohibit the employment of children under 15 years of age in commerce and industry and restrict the child labor to domestic or agricultural work. Many children, however, hawk goods in markets and junctions of major roads and streets in the cities to assist their parents in trade or commerce. When it comes to retirement, the statutory retirement age in Nigeria is 60 years or 35 years of unbroken active service, whichever comes first. After retirement, civil servants are entitled to benefits such as gratuity and pension. However, for decades, state governments in the country have had challenges paying these retirees gratuities and pensions. Social Security. So Nigeria has no social security system for unemployment, children disability benefits, or food assistance. Although some ad hoc programs provide support, the World Bank said that in 2019 that just 2% of households and only about 4% of the poor in Nigeria had access to them, which is pretty sad. Types of housing in Nigeria. So in Nigeria, we have public housing, private housing, landed estate, and long-term care. I would like to focus mainly on landed estate. I feel like it's important to note that, like, we're all in America. When you buy a house, you don't really own the land. It is a big deal in Nigeria. Well, it's very common for people to own their land. So once you build your house on top of it, it's yours. You don't owe anybody any money, which is a neat concept. I don't think that'll ever be adopted in America, but I think that's something to note. Significantly, public housing in Nigeria is predominantly targeted at low and middle income earners who constitute the majority of the urban inhabitants. Also, Nigeria's real estate market has been expanding rapidly, but so has the number of people in need for housing in Africa's most populous country. Nigeria's central bank says that the country has a growing deficit of at least 22 million homes. Long-term care. The traditional setting of long-term care practice is on the decrease in Nigeria, while long-term care facility known as Old People Home is on the rise, as nearly 6% of older adults population in the country are housed there. Also, there are rehab care in Nigeria, but they are only available in the urban areas, majorly in the big cities, whereby denying most senior citizens that are largely resided in the rural communities access to care. The main care that is available in Nigeria is palliative care. However, they do have a lot of challenges with that, mainly because there's poor awareness and lack of knowledge and skills, lack of resources, lack of trained professionals, and lack of government policy and priority. So although approximately 100,000 new cases of cancer occur annually in Nigeria, and more palliative care is needed. There are a lot of issues that need to be resolved before we are able to fully um, have an established palliative care because it is new to the country. However, they are starting to teach palliative care in medical schools in Nigeria, which is really awesome. So family arrangements in Nigeria. So the next of kin is ought to be the first person to know after someone has passed away. Um, and in order for everything to go as planned, we need to know whether that person had insurance or not. We need to inform the funeral directors, obtain the death certificate of the deceased. If we need any post-mortem examinations, those need to be examined. Mortuary facilities is usually where that body goes for a few days prior to a burial or cremation. But cremation is not really common in Nigeria, I will say. So Nigerian values. So when we think about family, Nigerians are big on respect of elders. Um, that's very, very big. They're big on education and patriotism. They love the country. When it comes to culture, weddings are a big deal, but so are funerals. So we like to celebrate each other within weddings, but also glorify those who, lived a long and happy life. When someone is like a child, like let's say a child died in a tragic accident or just died young, those aren't really like celebrated. Those are more so like sorrow sorts of celebrations. However, it feels like an older woman who lived a long, good life. Those are the type of funerals that we tend to like celebrate more and actually like be happy. When it comes to religion, the two major religions that are celebrated, well, that are practiced rather, in Nigeria are Christianity and Islam. Here are my references. And thank you so much for listening. And I hope you learned a thing or two about Nigeria. Thank you.